DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to Doc Talk. We're going to have a great show. Dr. Mike Apley is going to be with us from Kansas State University. We're going to talk about treatment protocols, case definitions, and a whole lot more. Thanks for joining us here on Doc Talk.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to Doc Talk. Look who's back. Friend and colleague, Dr. Mike Apley. Still, I tell everybody that he was a brand new professor at Iowa State when I first got to vet school, best teacher that I've had in school. So it's always a pleasure to get here and spend some time with Dr. Apley, who is the Frick Professor. He is in the Department of Clinical Sciences here at Kansas State University's College of Veterinary Medicine. All things feedlot, all things pharmacology, food animals, you name it. Laundry list of things that you do for our industry, and we really appreciate it.
Thanks.
So let's talk about treatment protocols. And, you know, I still use, in my yards, I still use the same treatment formats and protocols that you instilled in us and have so many other people. But let's just kind of start from the top.
Well, the first thing is not everyone has them, and the question is, why should I have them? I think that's the biggest question. And selfishly, they're a really, really good way for a veterinarian to communicate with their clients. It's a great way to put down what are we going to do on paper. And then when you have it on paper, it's not only a great reference point for the future, but it's a pivot point for us to talk about what we're doing and to go back and reevaluate it and have a formal reevaluation every 6 months or at minimum every year of what we're doing, what we're seeing, how everyone's feeling about it. And it's also a place that when you're building it, everyone has their 2 cents in. You include everyone gets to be heard and put in their thoughts, and off you go. And I don't know if formal is really the word, but it is kind of a formal way to put down what we've agreed on, what we're going to do.
It's kind of like a business plan or a strategic plan only for treatments, because when I get out there and someone sets the deal down with 5 different types of antibiotics and they go, I think this one needs, drug XYZ. I'm like, I kind of missed that lecture in vet school that you can just look at them and say,
It's the only one you missed. But anyway,
I went to most of them. Maybe some of the small animal ones.
Okay, let's just stop there. Anyway, the other reason for it, besides the internal needs and the communication part, is we need to get our ducks in a row to have them, because I really think you're going to have a documented protocol that people can look at to enter a lot of the food chains in the future. The market channels, it's going to be required that you have that. Let's get them done now and use them to our advantage. But that I've had so many great conversations based off treatment protocols and building them, and a lot of concerns come out or questions. The questions are great, and there's been more than one time when I've had to go back to the books to answer questions that came up in building them.
Yeah, and so and I would agree that, and they're vital to having the follow-up discussions when things aren't going right too.
Absolutely.
We see a lot of producers that don't have a relationship with their veterinarian. What's your recommendation there?
Let's find a way to get it. It's what the industry needs. We need to be working together, and we're heading some times with a lot of hard decisions about how we do things, and a lot of outside people looking at how we do things, and we need to be one voice in how we address that.
Awesome. Dr. Mike Apley, You're watching DocTalk. Thanks for joining us. We'll be right back after these messages.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
I'm Dr. Julia Herman, beef cattle specialist veterinarian with NCBA. Antimicrobial stewardship is a key responsibility that all producers and veterinarians have in the livestock industry, especially in the cattle industry. When we work with veterinarians, we're able to understand what products that we need to use for the animals that need to be treated. And we also work on responsible use of all of our antimicrobials. We want to keep these tools in our toolbox, and to make sure we do that, we need to be diagnosing our animals properly, having good treatment protocols, and making sure that we're taking care of those animals holistically with nutrition, low stress handling, good biosecurity plans. All of those play into antimicrobial stewardship. It's a responsibility we have as a cattle industry, and it helps improve the health of our animals and also the safety of our food that we are producing.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Mike Apley, who is the Frick Professor of Clinical Sciences at Kansas State University's College of Veterinary Medicine, world-renowned pharmacologist, and that's no joke. It's an honor to have you on the show again. Been on here many times, but let's talk about case definitions.
So the first thing about a treatment protocol is let's figure out what we're treating. And everything hinges off that. We can only talk about treatment response or treatment outcomes or what we're doing with the cattle if we know what we're treating. And I get eye rolls on that because, like, if we got to write that down, we got problems, right?
Yeah.
But so, for example, one of the things we do in training students, and we also do in clinical trials, is we have illness scores, which are really a depression score for bovine respiratory disease, which is the majority of what we deal with. So let's put numbers to it. And it can be as simple as 0 is we'd all agree they're healthy. They're bucking and kicking and looking good. And 4 is they can't get up. Those are the bookends. And then in between, we'll have 3 different stages. 1 is, well, let's argue if they're sick or not. 2 is we'll agree they're sick. And 3 is they should have been treated yesterday. And we can put in stages of depression and all this fancy word, but that's what it is.
Yep.
Can't get up, normal, and in the middle, those 3. And so we score together, and we talk about what we're seeing. And when you're scoring together, if you're arguing between a 1 and a 2 or a 2 and a 3, we're there. And we there's a lot of learning to be done in talking about those gradations. If we're arguing between a 0 and a 3, okay, we got work to do. But you use that, and what's a foot rot? How are we going to classify a foot rot? And when you go back on some of the work you were involved in, and you go, and over half of them are mechanical lesion something, and foot rot was what, 10 or 15% like
Yep.
that of the polls.
Pretty low.
Not everything that's carrying a leg is a foot rot, right? So let's talk about that and get it established for what it can be.
And we could find pretty quickly that if you're treating a whole bunch of threes, it's time to get deeper in the pen. And
Right.
so we use it all the time, because the more severe the lesion, the less of positive outcome we're going to have on treatment. So I agree with you that it is vitally important to not only define what it is, but the severity.
And there's two stages. One stage is what's going to make me get him in the chute. And then once you get in the chute, if it's temperature, if it's listening to him, auscultation, if it's further evaluation, but the time for doing depression and demeanor of the animal is before they get to the chute. We do that when we first observe them and bring them in, and then try to record it. But then we do something different in the chute. You put all those together, and now we decide if we're going to treat them or not.
Yep. Yeah, it's and I think that the one of the keys that you bring up that I find really, really fun is most people that are out there every day in the trenches in our feed yards, pulling cattle and doctoring cattle, have a true passion to learn what it is they're seeing. And when you start to put it into a case definition for a syndrome or an illness, it just light bulbs start coming on.
Well, the other thing is probably most of them are better than I am. They're really good. I know they are. But when you come together, it goes back to what we talked about before about the veterinarian and the client all working together. You all learn from it. And having some type of case definition to revolve around lets that happen.
Yep. Perfect. All right, folks, we're going to take a break. When we come back, more about treatment protocols with Dr. Mike Apley.
I'm Jeremy McBride. I manage the ranch for Wilmoths here in Southwest Missouri. Probably the biggest challenges in Southwest Missouri is the weather. That's where the therapies has helped us. The last day we got through weaning, it was 65 degrees and sunshine. And the very next day it dropped to 35 degrees, rained 2.5 inches, which is very, very hard on these cattle. And we doctored 2 head.
The seeds of financial security today with United Patriot Coins Precious Metal Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mike Apley. He's at Kansas State University. He is the Frick Professor in the Department of Clinical Sciences, teaches feedlot classes, teaches pharmacology, has taught all of us, not only in school, but at CE events all around the country, all around the world. Lots of service to our country, and we got him here on the show, so it's great. So let's talk about then, let's get right down to what the treatment protocol, how you develop it.
So we do this a lot in our classes here, and one of the first things is we're not writing a medicine text.
Right.
We're not.
Yeah.
We're basically starting with our case definition we agreed on, and it continues to evolve. We don't just set it and go. It continues to evolve. And then after we say, yeah, we're going to treat this animal, now we've got to describe how we're going to treat it. And it should be written so that anyone who comes in and helps can look at that protocol and go, oh, here's what I do. I take this size syringe with this needle, and I use this drug in this site at this dose.
Yep.
So at this volume per site. So dose, route, duration, frequency, and withdrawal time. So exactly what do I do? And again, it's like the case definition. People that do it every day go, but we've got to put it down so we all agree. I may find out you're using 1.5 inches for sub-Q injections, or vice versa. And so you go, oh, wait a minute. And it's all that in agreement. It's training, but it needs to be so write it. Like if you were going to tell someone how to tie a shoe that's never done before, you don't just say, well, you reach down and tie it. You say, first you bend over, you grab the ends of the laces, you do this. And it's the same way with the treatment thing. And it's not saying anyone's not smart. It's saying we're going to document every step of the process so we get it right.
And I think that the other side of this is there's some things we treat every day, and there are some things that are sporadic. And I'll be sitting there going, what the heck do we do for, Coxie or whatever? And so having that, it's kind of macho to say I don't need it, but it's a real relief to have it somewhere close when you do.
Yeah, and it's also a way of deciding what everyone's comfortable with. Because, for example, if you're going to talk about what you do with prolapses, there's all different grades and all different stages. And it's a time for everyone to talk about what they're comfortable doing and not doing. If we're abandoning cattle and one goes wrong, what do we do? There's some things you definitely don't do.
Yep.
And then when do I reach the end of my comfort level and I'm calling somebody? And everyone might be different, and that's fine, but let's get it talked about.
But that goes back to the VCPR, right? Mm-hmm. Just like we ended every segment. And, it's the veterinarian isn't just there to write a script or write the treatment outcomes. The next step is to be there when something goes wrong and they need to be on site or needs to have a plan to help those animals.
It's all just about planning in detail, especially about what you're doing with drugs. And it's not only about drugs, it's how we're going to move cattle through, how we're going to handle them. So,
yeah, when you see, the different, when you walk into a feed yard or you walk into a stocker operation and they say, well, our case definition and you're like, okay, I'm probably going to be doing the learning today.
Yeah.
And because they're on it.
Yep.
So, well, let's take a break. When we come back, we'll wrap up with Dr. Mike Apley. We'll talk a little bit more about treatment protocols.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. Mike Apley, who's the Frick Professor in the Department of Clinical Sciences here at Kansas State University's College of Veterinary Medicine. And we've been doing this a long time.
3 or 4 months. Yeah.
Anyway, whenever I get a chance to have Dr. Apley on the show, it's an honor. And so let's talk about we're talking about treatment protocols. What happens, and now we've developed them, they're in place. What's the follow-up afterwards?
So there's two big things. One of the things I didn't mention about the treatment protocol is just as important as what we do is how long we wait to decide the outcome, post-treatment interval.
Yep.
So we've got to agree on that, and we need to agree on that for each drug. Personally, I think there's a pretty standard post-treatment interval that applies to most antibiotics, and you can use that between the vet and the client to decide what works. And then once you get to the end of the post-treatment interval, we got to decide whether they need more treatment or they don't. And you go, well, that's easy. If they're better or not. Okay, what defines if they're better or not? And personally, I'd rather have a chute than a thermometer, a chute with scales than a thermometer at the end of the treatment period.
Yep.
To tell me how they were doing. And visually, if they look good and your eye tells you they're fine, I'm not sure I want to know their temp.
Right.
I think we can talk ourselves into retreating cattle that don't need it because they still have a fever. Fever's the body's way of responding to disease, and it may carry on a while. So those are all things you talk between the caregiver and the veterinarian about how are we going to decide whether they're better or not and whether they need treatment again and when. And then the other part of that is, okay, what if we say they're healthy today and 7 days from now we see them looking like they need more treatment? How, what's the second treatment? What's the third? What's the case definition? So you can just lay out everything that happens in an animal. We see it in the pen. We say it's coming in. We get it in the chute. We have criteria there. They meet that. Here's what we do. Then how long till they're eligible for treatment again? And then what do we do?
Yep.
What's the definition? And by the time you lay that all out, you've just talked through everything that happens with an animal that needs treatment.
It's and we take so much of this for granted. Mm-hmm. But as a veterinarian, we know how powerful if it's laid out in a organized manner and we do it correctly, we know how powerful that is to evaluate what it is we're doing on the health side.
Yeah, we both grew up in vet clinics, so we know one of the training techniques is to let you try it and then at a high level inform you what you did wrong, right? And hopefully these protocols are a way to do it the other way, where you prepare in advance, and then they're the basis for talking through how things went, how things are going, and adjusting. That's the big thing about it, the adjusting. And one of the things that we did was we agreed that we could always adjust them. We just need to talk before we do. And if you set that up, that works out really well.
Yeah, and like you said, everybody learns so much in those discussions. They learn the pharmacology, we learn what's going on the place, and you come together and it works. Yeah. Well, thanks for being on the show.
You bet. Thanks for having me.
Folks, thanks for watching DocTalk. Remember, if you want to find us, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson here with Dr. Mike Apley, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
the virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.